Hi, my name is Jalila Abdul Rahim. I'm teaching community nursing. Today I'm going to talk about home assessment and some assistive devices in community nursing. I want students to be able to distinguish between different types of assistive devices available, and I'm just going to go over some of the basic ones. Doesn't mean that there's all of them, but they're just the main ones. Um, I want students also to be able to assess the home environment to determine a fall risk, meaning a cluttered versus uncluttered environment. And I also want them to be able to verbalize the use for the assistive devices. The first assistive device that I would like to talk about is a cane. Now you can have a 4-prong cane, you can have a 3-prong cane, and you can have a 1-prong cane. I have examples of a 1-prong and a 3-prong, or a 4-prong, sorry, that I will show you a little later. But the difference is the more prongs, which means the extra feet basically on the bottom of the cane that they are, the more stability for the patient to walk with. One prong, which is one little tip at the end, just helps with basic stability. That's usually where people who have walking difficulties, small fall risk, start to begin to ambulate with. The next type of assistive device I would like to talk about is a walker. Now, there are several types of walkers. The most basic are the ones without wheels, just has the rubber stoppers on the end. You may have seen friends, family members, patients with tennis balls cut on the back two ends to make it easier to slide. They do have walkers now with the back two wheels to make it easier to push and slide. And they also have walkers now, many people refer to them as rollators. All four have wheels. They have a set of brakes. They have a seat, which is nice if you're walking for long distances and you just need a break. You don't have to go find a chair. They also have baskets to help people carry their belongings, just make it a little easier to walk around and carry things. These walkers provide more stability than the cane, usually keep them from leaning from one side to the other. And can be used in the home, like I said, help walk longer distances. It just depends on the circumstance. For instance, patients who have hip surgery or knee surgery who aren't weight bearing on one side or the other may benefit from a walker. The next type of assistive device I would like to talk about is a wheelchair. This is for people who need someone to help push them around. It usually has feet that goes on the bottom of the wheelchair, or it's preferable so that the patient's feet won't drag. Some people have the arm strength to roll the wheels along. Others need someone to push them. This is more so for your people who are a little bit more dependent. Maybe they're good at transferring, but they can't walk long distances. They're short of breath. They're weak. Um, COPD patients may benefit from that to help conserve energy. The only downfall is that it may be tiring, hard on the arms to wheel the chair along, or hard on whoever is pushing the wheelchair. But that's mainly the basis for the wheelchair, to help get around a little better when you're more dependent, not able to walk around as much, or bear weight on both of your legs, or maybe you have a wound on the bottom of your foot or something like that that you're not supposed to put weight on. So it helps out with that. Um, but that's it with the wheelchair. The next assistive device I want to talk about is the motorized scooter or motorized wheelchair. There's several types. I'm just going to put up a picture of a basic one. There's also hover-arounds that help lift up the patient, lean them back, things like that. Scooter is more so for energy conservation as well. It could be for those who are paralyzed, maybe from the waist down, hover rounds, things like that with the handle that are easy to maneuver will be easier for quadriplegics. Now, paralysis patients can also use the wheelchair too, but with the motorized scooter, the patient, as long as they have hand functioning, can maneuver their chair around and go from place to place versus someone having to push them or using their arm strength to roll the wheelchair around. The next thing I would like to talk about are ramps. And ramps are great if you have steps and you have to use one of these assistive devices, whereas you didn't do before, and you need to get up your steps and it's difficult for you to do so. They have different heights. For instance, a 6-inch ramp is for like a 6-inch front step. You can use it to walk up on with your walker, with your cane if that's easiest, with your wheelchair, with your motorized scooters. Um, and they're great in minimizing falls coming into the home upstairs. Um, and I have a picture uploaded of one of those as well that I will show you, but this is to minimize falls into the home, okay? Okay, now that we went over the basics of some of the assistive devices and ramps with the entrance of the home, I would like to discuss just some of the basics in the home. Now, what you're looking for is you want an uncluttered environment. Now, the first one I'm going to show you is a cluttered environment. And a cluttered environment just basically means there's a lot of things in the walkway. It's hard for you to maneuver with assistive devices or without them, okay? Okay, so this next slide should show an uncluttered environment. And this just means that the walkways, the floors are clear of clutter. You want to remove throw rugs. You want to remove clothes, toys, um, pets even, and I know that's difficult for some people. Um, and it just depends on how you go about pets because there have been instances that people have fallen over pets walking out in front of them. But minimizing what you have on the floor and reducing clutter and widening areas for you to get through with assistive devices or even without assistive devices helps minimize falls in the home. Falls, especially in older individuals, lead to a lot of injuries, um, or they may not be able to get up themselves. Hopefully, they have things like a med alert if they're there themselves, where they can push a button and let someone know that they have fallen. But as a community nurse, home health nurse, anything like that, when you're assessing their environment, um, not just in the home, but even out in public places, you want to make sure that you minimize fall risks. So this pretty much concludes my discussion about home environments and assistive devices. I just wanted to do something quick and sweet just do a general overview of things that you can do in the home and things that people may use in the home. And then again, just keep in mind that it's just not in the home. You may see these things out in public, so there's things to think about community-wise, period. Ramps are important to have going to stores and things like that these individuals will need to do as well. So the use of assistive devices, ramps, and reducing the clutter in any environment to minimize fall risk that may endanger these people who are using these devices or people with unsteady walking abilities and gait are very, very essential. And it is a big part of being a community nurse. Thank you.